It's been a harrowing few months for nursing staff on the front line of the COVID-19 battle. Of course, we'll be hearing more about this from Gareth Edwards live to Chris Hani, Baragwanath Hospital. And Gareth, you did mention a bit earlier on that, the wards are empty fairly. There are beds that are empty. Those are the visuals that you see at this moment.
That's right. We're going to be taking you to some of those wards a little bit later. It's just outside the main Chris Hani Baragwanath Hospital. Morning to all of those who have just joined us. It's a very rainy and grey day here in Johannesburg, but inside what you're seeing is still a state-of-the-art facility that was built very, very quickly. I'll tell you about the number of wards that they have here and the patients that they're still dealing with, and we'll show you those empty wards a little bit later, which is good news because don't forget, we don't want COVID-19 patients in hospital. But when I talk about how quickly this building went up, I'm going to ask my cameraman Teddy just to give you a sense of what this looks like. Here's a timeline of how quickly this was built, all the way from the far left there. That is the one of the first photos, the 19th of July, and as Teddy moves all the way to the right-hand side for us, if it's possible, it ends very quickly in October 2021. From literally just earth and dust, you can get a sense, Tumela, how quickly government is able to build a facility like this when the pressure is on. Obviously, a lot of these finances would have come from the emergency budgets which were put into place because of the state of disaster and the kind of funding that the government was able to get. But you can just see as Teddy zooms in there how quickly this went up. And these pictures, Toombs, do not give a sense of how big this facility is. So it's not inside the main hospital. It's called the ABT, or what's called an ABT. It stands for essentially Alternative Building Technology, which we may or may not get a chance to talk about later. Because our big focus today, of course, is inside of that building as we go back in the timeline. During the peak of the third wave, would have seen a lot more patients inside of these wards. But what we are going to show you a little bit later, Toombs, is one single bed, all on its own, no one in the bed. And then next to that is an area with about 3 or 4 beds, but it's also completely empty as well. I believe that I am going to be also speaking to one of our guests in a short while from now. We're going to be speaking to not just the officials who have been part of this structure from the very beginning, but we're also going to be hearing from those people who've been working on the front line. But I am going to now welcome, Toombs, if I can, Mr. Baldwin Mulaudzi, Director of Nursing Services. Good morning. How are you? It's good to have you with us. I know you just walked in. We are live on eNCA. So give us a sense, Mr. Mulaudzi, how are you feeling? 1st of October. They say rain in Africa is a good omen, and what I'm seeing here is empty beds. I assume you're happy. Good morning.
Morning, sir. I'm very much happy this wonderful morning that God has blessed us with this rain. I must admit that in October we are kind of relieved, more so because even our COVID stats have actually gone down. This building where we are in right now, it used to be a very hectic environment, but currently as we are speaking right now, we've got only 2 wards that are operational. This is in 500 bedded capacity institution, but currently we're only using 23 times 2, which is 46 beds. So I'm kind of relieved. Yes, in that regard.
So level 3, just take me back, because obviously it's very good news, Mr. Mulaudzi, that it is so empty. We want to keep it empty, of course we do. We don't want patients here. That's the whole point. Take me back to the worst that this facility would have dealt with. I imagine early lockdown level 3, but I see this building was completed in roughly late last year, 2020. I mean, how bad did it get here? How did you and your staff feel working through that third wave?
You know what, when we opened this facility, I must admit, we didn't have a staffing for it. That was a challenge for me. In as much as we were under pressure to increase our bed capacity, we didn't have the warm bodies around it. Thank God, it's a blessing in disguise that when Charlotte Mateke closed, their staffing was actually deployed here. So they were the very first people to open Ward 15. I remember Ward 15 and 16. Those are our 2 wards that we firstly opened. Then we complemented, province actually come on board and sourced out 2 nursing agencies, Nestec and Allmed. That's when we begin to infuse new warm bodies. And as I'm talking to you right now, should the 4th wave come in, we are already prepared. We have learned so much from the 3rd wave. I think if the 4th wave can come in any form and shape, we can be able to rise to the occasion.
So you're feeling prepared if and when that 4th wave is coming. Mr. Mulaudzi, we're told it's going to be early December, maybe. I just want to get your thoughts. We're now into lockdown level 1. I'm sure you saw the family meeting last night. I don't want to talk politics with you. You're a medical expert. I want to talk medical with you. Do you think going into level 1 lockdown was a good idea? What's your thoughts?
It is, believe me. It's not only staff that have got this COVID fatigue. Everybody feels kind of locked, you know. I think let's go out there and just get out of the COVID atmosphere for a little bit. That will be a litmus paper to say, really, can people drop their guard, or we can still keep ourselves in check. I think more than any other thing, if we were to look outside of politics, it's a good opportunity for us to go into level 1, honestly.
Tell me about how incredible your staff were, because during the very hard lockdown level 5, I know this facility wasn't here yet, but we were dealing, and you were primarily dealing with lockdown level 3. I mean, tell me what a day looked like for you and your staff. We've seen videos and photos of exhausted staff members. I'm seeing some of them arriving now with all the sanitizers and all their PPE equipment as well. How hard were they working? What was the toll on them emotionally?
Believe me, when we started, we were all paralyzed with fear. Remember, with COVID, it was a new phenomenon to us. Nobody knew how to maneuver around COVID environment. But as time goes by, we're getting guidelines to say this is how we need to go about it, especially things like your PPE as well. We're all paralyzed with fear when this pandemic came in. But however, I must commend my staff, really. They came on board. I remember some of the staff members came to me to say, Mr. Mulaudzi, we are coming forward to volunteer to work to the COVID wards. I must really take an opportunity to, if maybe we were to have a staff award ceremony, I must really thank these staff members that they really came on board. And again, we had so many of our staff members that got sick as well. I remember in Ward 38, when all staff members got sick, they were confirmed to be COVID positive. So I didn't know how I was going to rescue the situation. But flexibility amongst our staff members, really, I must commend them. And the teamwork is something that we have really learned out of this COVID environment.
Well, I appreciate your time. Congratulations to you and all your staff, and all the very, very best as well as we head towards this 4th wave and putting together and managing this incredible facility. It's Mr. Baldwin Mulaudzi, Director of Nursing Services here at Chris Hani Baragwanath Hospital. It's the ABT building, if you will. This new facility built just a short while ago. We're going to be showing you how empty, Tumelo, the wards are a little bit later. The entire facility isn't empty. There are 1 or 2 wards with some patients in, but the majority are empty. So a little later when you and I chat again, everyone joining us this morning here on the South African Morning can get a real sense of what the vaccination numbers going up means for a facility like this. Let's not forget, it is good news. It's good news when we see an empty COVID-19 facility. That's what we want. Toombs, back to you.
Yeah, indeed, Gareth, it's very encouraging, especially with that anticipated 4th wave by medical experts. I hope we could keep it that way and continue to flatten the curve. Gareth Edwards will be sure to come back to you, of course, quite soon with more from Chris Hani Baragwanath Hospital.